Weight gain in pregnancy, there is the standard recommendation that women should gain about 25 to 35 pounds in pregnancy. But that is very variable, and it really does depend on how much you weigh before you actually get pregnant. So for women who are a little underweight or very thin, it's not uncommon to see women just naturally gain 35 or even 40 pounds in pregnancy and be completely fine and very healthy. On the other hand, for women who are overweight to begin with, they don't need to gain 25 or 30 or 35 pounds, and even if they gain 15 pounds, that would really be sufficient for the growth and the development of the baby.
The misconception that I really want folks to understand is that the mother actually does not have to gain weight for the baby to be healthy. The mother has to eat healthy for the baby to be healthy. And the baby has to gain weight for the baby to be healthy. But we are stuck weighing the sum total of mother and baby. We cannot weigh the mother and the baby separately. So sometimes the sum total of the mother and the baby doesn't change very much. I've had a patient who gained 10 pounds with her twin pregnancy and had 8-pound boys, because for the first time in her life, she was motivated to eat healthy the way we all know we should eat: lean proteins, fruits and vegetables, exercise regularly. And what was happening is her own body was actually getting leaner and fitter, and her boys were growing very healthy, and the sum total of the three of them did not change very much. We cannot control the numbers on the scale. The scale is going to say what the scale says. What we can control is how we eat and how we exercise. And if we commit to doing those in healthy, sensible ways, the numbers on the scale will take care of themselves.
If you happen to be overweight, that's not a problem and it's not a risk to your baby. The most important thing to remember is that you're eating for you and you're not eating for two. So the only extra caloric intake you need is about 100 calories, which is about an extra yogurt a day.
In general, we want to encourage women to continue to be active during their pregnancy. There's really no contraindication for a healthy pregnancy for a woman not to continue her normal exercise regimen. Women who are already athletic and active are going to want to recognize that they're going to have about a 50% reduction in their exercise capacity during the first trimester. It is fine to continue your normal exercise routine throughout the pregnancy. If that includes running or cycling, active sports, those are okay to do. You want to make sure, though, that you're not engaging in any sports that could become more difficult as your center of gravity changes. So things like skiing or other really active sports where it depends on balance may not be appropriate to continue into the late second and into the third trimester. For women who are moderately active, continuing to walk or jog gently during pregnancy is fine. Swimming is also a great activity throughout pregnancy, and as you get towards the end of the third trimester, I can tell you that it feels really good to get in that pool and have some of that weight taken off of your hips and your ankles. I've been a weightlifter since I was 20, and I did continue to do that during my pregnancies. There's a lot of good evidence that it is safe to continue. What you want to do, though, is to decrease the amount of weight you're doing, and you can maintain your muscle mass by increasing the number of repetitions you do. A lot of people don't realize that when you have a baby, it is a total body workout, and you not only are using your belly muscles and your leg muscles, but also your upper arms and your whole physical being to give birth to that baby. And so being in the best physical shape you can is really important with that. Also, obviously, if you're in good physical shape when you go in to have your baby, you'll be in good physical shape after you have your baby, and you'll be able to get your shape back as much as you can more quickly.